My name is Madi Partovi.
And I'm Dr. Ryan Partovi.
Welcome to the Partovi Effect, creating the consensus. And what creating the consensus means to me is no matter what we bring to the table, no matter what we talk about, no matter what we talk about with our guests, may we always be present to the unity and the connectedness that inherently exists between us.
I did want to make sure we touched on the cancer screen because that's something I'm really excited about.
Let me segue into that.
Okay, great.
So when you hear somebody sharing about their cancer journey, you often hear, I have stage 3 or stage 4. I was sitting with a friend the other day and he asked me, why isn't it stage 1 or 2
Or stage 0.
or stage 0?
Yeah.
Because that kind of screening is not happening in conventional medicine.
Yeah. Yeah, because they say, oh, it's not worth the cost. It's too much of a drain on our resources. It's a bit absurd in my view, because these are simple lab tests that are available. And in fact, there's a lot of third-party companies that do charge. They charge because they're cash pay only, and they'll say, oh, detect whether or not you have cancer in a drop of blood. And they'll check for 3 or 4 of the cancer antigens that we currently have available that are readily available, Quest, LabCorp. My question is, why are we not running all 13 for men, all 11 for women? Men have a few extra because they have prostates. And people ask me, what about ovaries? I said, well, the ovarian cancer marker also shows other cancers. So there's not like an ovary specific one. But people, why are we not running all of these on everyone, especially over age 55, which is when we know that cancer skyrockets? Why are we not running them on everyone every year just to see, is there possibly a stage 0 disease process? You have to ask yourself, when the only options you have available to you are chemo, which would be considered far too toxic, radiation, same thing at a stage 0 cancer, or surgery. Well, how are you going to do surgery when you can't see it yet on imaging? They don't have any other options. But whereas the reality of the matter is that there's dozens, if not hundreds, of studies. There's dozens of, if not hundreds of interventions, thousands of studies that have been done on many different interventions, both natural and conventional, that have been shown to have anti-neoplastic, anti-cancer benefits. So why are we not saying, okay, you have stage 0 cancer, which is to say it's so small we can't even see it. We're not even exactly sure where it is, but we can see in the blood that there's a there. So let's go ahead and start treating it with all of these anti-neoplastic therapies that are very safe and very effective, and see if we can't prevent it from ever progressing to a stage 1 or a stage 2, et cetera. And to me, that's really the future of cancer care. I don't know why we're the first ones doing it, probably because, and there may be others, but I don't know of any. Probably because, again, it's just something that either they haven't thought of, or they're worried about the rising cost of healthcare and the healthcare burden. But my comment is it's so much cheaper to do these screens for the patient. If I were a patient, would I rather know that I have stage 0 and where I can do something about it and keep a close eye on it and follow the tumor markers? Or would I rather just wait till I have some stage 2, 3, 4 cancer that now I'm going to have to take toxic chemotherapy for? And of course, if that's the other thing you have to keep in mind is medical oncologists, who are like the primary care doctors of the oncology world, the cancer doctor world. What they don't tell you is they make up every month, every year, 60% of their income comes from the upcharge they charge your insurance on the chemotherapy that they're prescribing you. We make 10% of our monthly income from FullScript, which is the online prescribing platform we use for nutraceuticals. These are natural medicines, food-derived medicines, botanical herbal medicines. We really appreciate it when people order through FullScript because it does help us to pay the bills. And we're very open about it. We're very upfront. Okay, right away, we want you to know, yes, we do get 10% of our monthly income from this. And so when you're ordering from them, you're helping us out, and we appreciate that. Worst case scenario with these interventions, assuming you're taking them as prescribed, maybe let's say worst case scenario, there is a conflict of interest, and maybe there's 1 or 2 that maybe you don't strictly need as much as maybe I think you do. Okay, but now you have some side benefits, right? Because that's what these things provide. These are natural medicines, and worst case scenario, you get some side benefits. With chemo, radiation, can you really say the same thing? So my concern there is just there's this absolute perverse incentive, absolute conflict of interest that nobody likes to talk about in the cancer world that's really fueling the current cancer model, where they'd rather wait until you have a stage 2, 3, 4 cancer so then they can treat that. Now, if you ask the doctors, of course, they're going to say, absolutely not. We would never want anybody to get cancer. But then they'll point to studies, which, of course, who pays for the studies? Big pharma. Who pays for the studies? You have to keep in mind that the studies are then going to say, oh, there's no evidence for this, or the cost benefit ratio isn't good enough. I don't care. If you're a cancer patient, there is no cost benefit ratio to getting regular cancer screenings that would have prevented you from having to get chemotherapy. I mean, are you kidding me? It's like anything. I would have paid anything to have to avoid that. And so the idea that we're not doing that and implementing that on a societal level, I think is, personally, I view it as kind of criminal or maybe insane or maybe both. But I think that at the very least, our practice is doing its part to try to reverse that trend by offering people regular cancer screening as part of our wellness plan.
Beautiful. You, Dr. Ryan, have been treating cancer for almost 15 years. And we have a very exciting announcement that we are introducing repurposed drugs into the game of treating cancer.
Yeah. I mean, we've been using a little bit here and there, but I would say that for people who don't know, repurposed drugs are drugs that are on generic. They are typically much lower cost than anything you're going to do chemotherapy-wise. And these are medications that are going to be functioning along one of two different pathways. They're either immune modulators that are going to help the body find and fight cancer, or they're metabolic disruptors. So obviously, or many of you may have heard that sugar feeds cancer, but until the work of Dr. Seyfried and Dr. Merrick, who have really said, okay, why don't we treat cancer, this thing that needs, it's high metabolic need, sugar we know feeds it. Why don't we try treating it with some anti-diabetic medications? And it turns out that there's research showing that's actually really helpful. So it's a totally different approach. And we're not saying do this instead of chemotherapy or instead of immunotherapy. In fact, I'm a big fan of immunotherapy. Immunotherapy is basically monoclonal antibodies for your cancer. But what we are saying is, in addition to whatever chemo, radiation, surgery, in addition to that you choose to do, we want you to be aware of and make available to you immunotherapies, immune modulators, and metabolic inhibitors, along with all the many natural therapeutics that we've been using now for over 14 years, and really create this sort of comprehensive, truly integrated approach to cancer, where you're able to pull the best of all these different possible worlds and really get a phenomenal outcome. So that's why we've created our cancer practice, has really been inspired by the FLCCC's use of repurposed drugs in cancer. It was documents, a 217-page document that Dr. Merrick has published. Dr. Merrick, for those who don't know, he came to prominence really prior to COVID. He was known as the #1 most published intensivist in the world. Intensivists are ICU doctors, former professor times decades, and created a really unique protocol for use in sepsis that's had unique efficacy and has really been on the forefront of the COVID pandemic, and has now said, okay, well, how can we apply the lessons we've learned about conflict of interest and perverse incentives and looking at diseases in different ways. All those lessons we learned from COVID, how do we apply that? And he comes from a very traditional, very conventional background, and really bringing that very hard-nosed research mindset to the question of cancer and natural, integrative, and holistic therapeutics, and come up with a really great protocol, which adding those elements in is just opens up a whole new world of possibility for cancer patients, and not only more targeted treatment, but obviously through being more targeted and from approaching it from more angles, much more effective treatment. There's a clinical trial that is ongoing now as part of the FLCCC, and by being in our practice, you have an opportunity to get access to the clinical trial protocols right away. So you don't have to wait for the studies to all come out saying, okay, yes, in fact, these treatments for which we already have dozens of studies showing on a basic science level that they should work. In fact, they do work, right? And again, they're compared to chemo, the cost is a drop in the bucket, which is why obviously there's a lot of incentive to keep you away from that from the conventional paradigm. So just keep that in mind. I'm not telling people don't get surgery, don't get radiation, don't get chemo. I'm just saying, at the very least, consider these other options. And even in conventional medicine, some of the things that I found frustrating is that we have these new immunotherapies and immune modulators, which are broadly accepted as second and third line treatments by the conventional medical oncologic establishment. But what they're not saying to you is that the side effects are often fewer, less severe, less common, and or shorter in duration. In other words, if you have a side effect, you deal with that side effect right in that moment, and then it's dealt with. Whereas with a lot of the traditional chemos, the mustard gas derivative type chemos, or the heavy metal, the platinum derived chemos, you're dealing with long-term side effects 5-10 years into the future that can potentially not only diminish cardiac capacity, but also increase your risk of cancer in the long run. So you end up, maybe you get the first cancer you had goes away, but then you now have a second cancer that was as a result of the way you treated the first cancer. So why not use some of these, frankly, safer, often just as effective immunotherapies, immune modulators first, and then save chemo for the backup option? And I think the
slash and burn,
right,
petroleum derivative,
right,
mustard gas alternative.
Yeah, let's save that for like when all else has failed. And the reason for that is largely habit. It's largely we've been using these for a lot longer. And so because of that, there are more studies showing that they're effective. And so even though there may be 2 or 3 showing that these new drugs are effective, the standard of care that's been established over the course of the last 60, 70 years is to do these slash and burn drugs first. So that's what we always do, right? It's more of a habit, frankly, than actually being driven by the evidence. And when they say, oh, we're practicing evidence-based medicine, yeah, but you're looking at the evidence through a particular lens. And I think if you come at it from the naturopathic lens, which is the first do no harm lens, then we want to try to minimize the amount of harm relative to the amount of benefit. And that's why I tend to be more of an advocate for immunotherapy, immune modulating therapies, and metabolic therapies, in addition to all of the natural anti-neoplastics versus traditional chemo, radiation, et cetera. Yeah, I think that's a pretty good overview of our cancer. I mean, there's one other thing I would mention about the cancer practice, which is that there are certain tests, and most people have their biopsy sent off, and they do genetic analysis on the biopsy to get the diagnosis. What is now available, and a lot of oncologists don't even know is available, is there's the ability to send off the sample, whether it be bone marrow or a biopsy from some solid tumor, and have it analyzed genetically for which specific immunotherapies are most likely to be effective. In addition to that, any other investigational therapies, whether they be immune modulators, et cetera, are most likely to be a benefit in this person's particular cancer. Also, which clinical trials are most likely to be of benefit in that particular patient's cancer. And what we have seen over and over again is a medical oncologist not doing that test. Maybe they're not aware of it, or maybe they just don't do it. But suffice it to say, in our view, that should be one of the first things that cancer patients do, so they can really evaluate, okay, based on the evidence with the genetic characteristics of my specific cancer, what should I be doing, and what maybe is less likely to be effective for me. And that's one of the first things we do in our practice, is get some of your biopsy samples sent over to the lab that does that test and get that test run so we can get their recommendations about possible avenues of treatment.
You know what I just got present to?
Tell me.
You are the embodiment of possibility in medicine. And then I have constituted myself as the possibility of aliveness and alacrity. And we had an Aspen Wellness Institute baby.
Mhm. Yeah, absolutely. I think that what you mean by possibility medicine, and I'll just clarify it a little bit, is this idea that anything is possible. A way that I manifest that in my practice is the idea that I always say, given enough time, I think any cancer is curable. Any cancer can be put into remission, is what they call that, right? I mean, they never want to say cure because, of course, it can always come back, but any cancer can be put into remission given enough time. The question is, will we have enough time? So a lot of what we try to do here is give the body more time. That's a big part of the approach, is let's try to extend the lifespan, extend the cancer span. And we've also worked with patients who they have advanced stage 4 cancer, but they've gotten so healthy that their symptoms are non-existent to minimal. And so they've basically lived with stage 4 cancer in their bodies for 20 years. And that's also very possible. And so I know everybody always wants to get cancer free, and certainly that's our intention, our goal. But not everybody's able to do what it takes to get cancer free because sometimes it's too hard to comply with the therapy or it's too much. And so it's like, how can we maybe get you healthy enough so that you can have the stage 4 cancer in there, but it's kept in check to the point where you're actually able to live a very full life and with very good quality of life for 5, 10, 20 years, living in harmony, if you will, with the cancer. And that's heresy in the conventional medical world. It's where you're doomed. If you have cancer, you're either doomed to this progressive decline and death in a short period of time, or we're going to cure you with these heroic measures. That's one way of looking at it. But the other way of looking at it would be that we all have cancer at various points appearing in our body and disappearing because our immune system deals with it or the cancer dies off all the time. And so really it becomes a matter of the ability of the body to deal with those cancers gets impaired, or the cancer is able to adapt to the point where the immune system is not able to see it. And in either of those circumstances, there's ways where we can either help sensitize the body and help it find and fight the cancer, or there's ways that we can relieve some of the pressures on the body so that it is able to deal with the cancer, so that we can then put the patient in a situation where even though they may have technically still have stage 4 cancer and it's detectable, they can get to be so healthy that they can live a full life. And so that's something else I think standing in anything is possible. The idea that there's nothing more we can do, which of course is like the famous doctor saying, which you're going to get at maybe a lot of more conventional old school style practices. We just don't believe that here. There's always something more we can do. If we've already approached your disease immunologically and it's an immunologic disease, maybe there's a neurological component. The mind-body connection is real. Maybe there's a cardiovascular component, a circulatory component that we need to address we haven't addressed yet. I mean, in other words, maybe by thinking totally outside the box, if you have what's seen as, for example, a rheumatologic or oncologic or whatever problem, typically you go see the rheumatologist or the oncologist, and they're going to focus on their narrow view of that. Maybe if we do that, plus bring some other things from other disciplines, or even other totally different approaches. I never forget one time I had this patient presenting with chest pain, and she was a young woman. I did my initial visit with her, and I said, I don't think this is cardiac. Yeah, so I sent her over to our friend of ours who's a NUCA chiropractor, which is a specialty inside chiropractic. That's the most evidence-based form of chiropractic. And I said, I want you to treat her and see what happens. And he called me, he said, this woman has chest pain. What are you doing? Like, why wouldn't you send her to the hospital? I said, well, I've really evaluated the case and I just really don't think this is cardiac. I want you to treat her. Let's see what happens. Sure enough, even after the first treatment, she started to get better. And within 2 weeks, it was totally gone. Sometimes people have symptoms and the workup is going to be unrevealing. And I promise you, if you had sent her to the ER, they would have done a whole workup for chest pain and found nothing wrong and told her it was all in her head. But the reality of the matter is, by sending her to the chiropractor, we were able to get her symptom actually resolved. And she didn't need follow-up treatment. Within 2 weeks, she was good. People have this sometimes a story of, oh, I'm going to be stuck at the chiropractor's office for the rest of my life. Not necessarily, not if you're doing the right stuff. Yeah, it's really interesting how, and look, sometimes you need a cardiologist. Sometimes you need to go to the ER, right? And Dr. Diadamo loves to say, if you have a safe drops on your head, go see them first. Go to the ER, right? If you're bleeding out, go to the ER. But if you've got a complex disease, you've got a chronic disease, you're not sure what you have, come to us first, because chances are we'll be able to figure it out. I've had so many patients who've gone to major medical centers, but I remember I had this 19-year-old patient who she'd been to Yale gastroenterology. She was having stomach issues and cramps and diarrhea, and they couldn't figure out what was going on with her. They supposedly had run all the tests, right? But the celiac disease test we run is the most comprehensive form of that test. Sometimes doctors will run one or two components of it. We're running all 7 or 8. I forget exactly how many. And come to find out, on 2 of those 8, she was positive. And so she had celiac disease. She avoided gluten. Her symptoms went away. She told me, she said, sometimes I will eat a sandwich just because I really miss having a good sandwich. And I know I'm going to feel like hell for 3 days after that, but sometimes it's worth it. I said, hey, at least you know what's going on, right? At least you know what you're doing to yourself. So I think a lot of people can get a false sense of they've done everything they can. There's nothing more to be done. And we dealt with this recently with a good friend of ours who recently passed away from cancer, basically was totally unwilling to pursue anything that we do, anything outside of the conventional medical establishment. And it's heartbreaking because we knew what a difference we could make for her, but at the same time, people have to be open to it, right? So please don't send us your family members, have them come to us, because that's what works. It doesn't work to say, I'm going to pay for my cousin or my niece or my grandmother, and they're going to come see you. No, you can give them the money, but then they need to be the one to actually initiate it and say, hey, this is something I want for myself in my life, and I'm going to be coachable and I'm willing to follow what the doctor says and take it on, really take it on, like my life depends on it, because often it does. So
It makes a difference when you're sourcing your own care, when you're an advocate for, and when you're a champion for your optimum health and wellness. And
yeah.
that's what we're about. What our overarching commitment is on the planet is the end of human disease.
Now,
Now.
yeah. Because really, there's no reason why people should be getting sick. I mean, you're going to get sick, but dying from illness. Our goal is everybody dies from just reaching that Hayflick limit, getting old age, right? Getting to the point where their cells just can't keep reproducing. That's something that we both fervently believe is possible and we've experienced as possible. And people are truly able to have their health restored or to continue being healthy for decades beyond that which is typical. And right now, I'm not saying it won't change in the future, but right now we know that human lifespan is pretty close to 120 years, and that we believe it's possible for everybody to get there. It's about willing to take the actions that are necessary. And if that's something you're committed to, great. And if you're just looking for, hey, I'd be happy with another 20 years from wherever you are, I'd say great. And there's no reason why we can't help people wherever they are along their health journey. We have some patients that are over here and they're already doing 85, 90% of what we would want them to do. And it's really just about bringing them that extra 10%. We have some people who are just beginning. They're like, why should I eat organic? Isn't that just a scam? We kind of explain it and walk it through, and here's why. And you're on a limited budget, here's the most important things to focus on, and hold your hand through the process. But the goal is really in the beginning, we start with a lot of explaining and hand holding and working our way toward, okay, now we're eventually walking alongside you, and then eventually we're coaching you from the sidelines, and then eventually we're up in the stands cheering, right? Because you're doing so great all by yourself. You don't even really need us, but maybe for once a year check-in, just for you to play us the song you wrote for your guitar or your piano or whatever, or show us the painting you painted, whatever it is that you're up to that brings you joy.
Yes. And that's what you can count on us for, to practice honest medicine, to honor your biochemical individuality, and to have your pathway, the lifetime of your health and wellness, be the most wondrous journey.
Absolutely. Look forward to it. Yeah. Oh, you know what? There's also one other thing we didn't mention. We talked about the end of human disease now. What we didn't talk about is the other side of our overarching commitment to the planet, which is the transformation of healthcare on the planet.
Yeah.
And what that looks like is a transition from the disease care model, what I like to call the ambulance waiting at the cliff, at the bottom of the cliff, waiting for you to fall off the cliff, and then it's going to whisk you off to the best, most advanced, technologically advanced hospital in the world, which is basically the foundation of our current model, this disease care, health insurance model, which is if something bad happens, we'll take care of you, versus what would be like a health coverage model or health care, which is what most people think they have. They call insurance health coverage. No, that's not health coverage. That's for if you fall off a cliff. And what they're hoping for at the insurance company is that you have a heart attack 500 miles from the nearest hospital, so that by the time your health insurance benefit would kick in, you're already gone. So you've been paying in, but then you have a quick death. That's what they're hoping for. That's their business model. Our business model is to keep you alive, because if you're not alive and we don't get paid, which is really how it should be, right? It's about, hey, we should be getting paid to keep you well, and to get you well and to keep you well. And so if you get really sick and have to go in the hospital, we've had a failure in performance. So I think ultimately part of our goal is to keep you out of the hospital, to work on a preventive side. And obviously that requires partnership. It requires us working together. It requires you being coachable. And really about the goal of that transformation of that system is we are at the top of the cliff saying, hey, there's a cliff here, putting up signs, making a railing, saying, turn back now, be careful. And that's really that fundamentally preventive proactive approach is the foundation of the practice. And I think really the foundation of the kind of healthcare system our planet needs and the kind of healthcare system we advocate. I always say, look, if I woke up tomorrow and everybody was practicing medicine the way I practice, I could retire and do something else.
Like podcasting.
You know, that's something we're doing as well. But that's the thrust, that's the motivation for the podcast ultimately, is to teach not only patients and people who are just the general public, right? But also to teach other doctors, hey, you could be practicing like this. You could get back into private practice. Only 30% of doctors right now are in private practice. 70% of doctors in the United States practice. They are basically employees of a big hospital system. And big hospital is just as much part of the problem as big pharma. We could probably do a whole podcast just about that. But suffice it to say, they're in cahoots and feed off of each other and are basically two sides of the parasitic system that we have currently, of people basically profiting off of people's misery. As my cousin Amy, who is a conventional medical doctor and has been in the system for 2 decades, says, so I'm quoting her, I want to give her credit for the quote and also say she has been on the inside, so she knows.
I have a certain measure of respect for conventional medicine. And what do I turn to day in and day out? Naturopathic, integrative, holistic medicine. I'm also a patient of my husband's. And a very
coachable, very compliant. Otherwise it wouldn't work. And I'd refer her to one of my friends. She knows that, right?
Yes. And so it makes a difference, and it matters how coachable you are when you are handed the keys to the kingdom. I love doing this with you.
Yeah, likewise.
All right.
So I'm Ryan Partovi. I'm Dr. Ryan Partovi.
And I am Mrs. Madi Partovi. And one day I'll share why I always say I'm Mrs. Madi Partovi. It's an inside joke.
This has been the Partovi Effect, creating the consensus. Thank you for joining us. Thank you for your time, attention, dedication, commitment to yourself and your own well-being and the well-being of others and the planet as a whole.